All right, good afternoon, everyone. I'm Todd Green. I'm superintendent here at Beaver River. I want to thank you all for joining me for this second virtual meeting, virtual forum that we're having for our public. We picked a different time, thought maybe we'd get a different audience if folks needed that, but we are recording this today. So you'll be able to review it when we get done. I want to thank everyone who's given their support for the many difficult challenges, and I want to say I understand there's a ton of difficult challenges at home as well, and that's hopefully we can work as partners through this. So tonight's presentation is really giving an update from information based around a frequently asked questions document we created from questions that have come our way. So I'm going to work through that tonight, and then see if there's questions throughout the evening as well. So if you've joined on YouTube, you should be able to add a question, text in a question, and I'll be able to see that throughout this conversation. There's a little bit of delay from me talking to what YouTube sees, so make sure you get your questions in early enough so that they get addressed for sure. Looks like right now we have about 40 people that are watching, and I'm sure there'll be more to join. So I want to thank you all for joining and participating in this process. So what I'd like to do is I'm going to switch my screen over and show you our how we get to our frequently asked questions document. So it'll show up in just a second. And we've posted it on our website. I'll come up in just a minute. And when you take a look at it, you'll see that this is our website. We've posted at the very top some new information just today. We have parent-student reopening resources. I do want to come back to that a little bit to show you what it looks like when we're done. But also want to show you the FAQ. This hopefully will answer many questions that folks have had over the last week or so. So we'll take a look at that. While that's coming up, I understand we've sent out letters last week to indicate our orange group and green groups. We understand many of those didn't make it home, but our offices have been calling families that weren't able to respond to be sure that we can fill out transportation information. We're working on that as we speak, so making sure that our bus runs will work. If we need to shift anything, we'll do that as well. Apologize for that, but if you haven't received your letter and you didn't get it today, go ahead and call the middle school, high school office. They will give you the information for your groups. We're working on that type of communication as well. So I wanted to just hit some topics. This document is sorted, some headings. We start off with some general questions, then we hit some other major topics. So I'm just going to work my way through this. As people have questions, you can definitely type them in into the chat section of YouTube. Okay, so one of the big questions we have right now is if my child doesn't have a medical condition that for them to stay home, but I feel more comfortable with them staying home, can I do that? We've had this question come across. Basically, at this point, we do not have a way to allow just remote only to take place. So currently we have two options. One option is to do the hybrid schedule. We'll go over that again just to make sure people understand that. Or they can participate in homeschool instruction, and to do that, you'd have to participate or call the middle school office. If you have a case where maybe you have a child that has an immune system that is compromised and the doctor says they shouldn't come to school, we're going to work on individual cases on what that will look like for folks. Understanding that is something that we need to figure out how to do a remote only process for that for those that are unable to come to school for medical reasons. Another big question, and these are probably the hot ones, does my child need to wear a mask all day? Polling the state education and DOH guidelines, basically students need to wear their masks whenever they're within 6 feet, when they're in hallways, restrooms, and in other congregate settings. And basically in a classroom, if there's instruction taking place, the teacher's in the front of the room giving instruction, and we set up the rooms to be, the desks will be 6 feet apart. Students are going to be given permission to take their masks off. We also need to provide mask breaks, so that'll take place. And in some other cases, depending on the situation, depending on what the students are, who the students are in the classroom, as well as the teacher condition, the teacher may request to keep masks on during class for the entire time. But there will be breaks given. So just want to make sure that that's understood, that the idea is that there will be masks throughout the day, but there will be breaks. And typically in instructional time, they'll be able to take those masks off. Excuse me. Okay, sorry about that. Will the school provide face masks? We did find out that many students already have face masks, so they're welcome to wear those face masks as long as they meet the guidelines, as well as we've got masks to provide. Some that we have are just the generic white ones, but we also have some that have the Beaver River logo on them. So we'll have that for you as well. What are the symptoms? We want to make sure folks have seen those. That's not anything new. Here's a big question that has come up. What happens if a student exhibits symptoms during school? Now remember, this is symptoms, so there are a ton of different symptoms that fall under here. So we've been working with public health on what the process is to do with a student when they have those symptoms. So when those symptoms take place at school, obviously if they're at home, any of those symptoms, you should keep your child at home. Don't send them to school. You know, if it's not COVID-19, good chance they're going to recover quickly and they can be sent back to school when it's time. If they exhibit them during school, so midway through the day, they'll go down to the nurse. The nurse will first take a look to see if those symptoms match the COVID-19 symptoms and is, and if it's determined that they are, that student, if they are part of the clinic, they can move over to the clinic and participate in potential testing from there and the clinic suggestions. If they are not, they would move from there, they would move to an isolation room. We would call the parents and say they need to come pick them up. And the parents at that point need to decide what to do. And really the decision should be take your child to your doctor, and the doctor can decide a couple things. One is, okay, this is something simple. This is something I've been treating. This is something that is not COVID related. They'll write a note and the student can come back to school the next day. So a doctor's note to return to school can bring them back to school. The doctor may say, well, if this is potential COVID-19, so then they would say we need to do a test. So they'll go through the test process. They will contact public health for testing information, and they'll go through that process. And then if there's a negative test that comes back, that student's allowed to come back to school. In either of those cases, if the time frame for return to school is 14 days, they can return to school if they've been asymptomatic for that amount of time. So it really, in terms of testing, that's how we would work with students. I'll cover in a little bit about testing for asymptomatic students. That one will be pretty clear when you'll see that in a little bit. But I wanted to just, make sure that you see that there is a flow chart for if a student is symptomatic or there's a positive case, what happens. And we are really following public health guidelines along with that. If anything changes, we will update this this document so that you'll be able to tell what the process is. But really, the best advice I would say is that if your child has symptoms and they're home, they should stay home. If they have symptoms at school, we'll call you and they should go see their doctor. Because at that point, it's potential they could get a doctor's note and to come back if it's really not anything related to COVID-19. Okay. There's the idea of testing of students and teachers. So essentially, we are not a testing site. I know there's been some confusion around testing. We do not plan on doing testing here at school. Now, we do have the Carthage Clinic. So if they have the capability to do testing, there's a possibility that testing may take place there, but they are the health professionals. We're going to stay in our lane in education, and for testing, we won't be doing that. We are providing links, you'll see it down a little bit, to the county information for asymptomatic students. There are some local places where you can get tested for free to get if you're asymptomatic, okay? We did want to talk about transportation. Just pause for a second. Just remember, if you have questions around that, make sure you put those questions to the YouTube channel here. Around transportation, how will students have their temperatures checked on the bus? We've actually purchased mountable temperature check units. So it's going to take their temperature on their wrist. So what will happen is at the bus stop, your students will be there. There really needs to be a child care provider at home, just in case that the temperature check puts them 100 degrees or higher. And if they're 100 degrees or higher, they're going to need to stay home. So the child care provider needs to be there. For the first part of the year, we'll have monitors on the bus that will help process that. Students will enter the bus. They'll get their temperature check. If they pass, they'll come right on the bus. Most students will pass. They'll be given a wristband. That wristband is basically like a ticket into school. It allows them to just enter right in school when they get to school. In the case of students who have 99 to 100 with a temperature check, they're still going to be allowed on the bus. So obviously 98.6 is good, 98.7, 98.8. 99 to 100, there may be an error with the reading. So when they come, they'll be given a special time to go get their temperature checked, either in the nurse's office or a screening location. Just as a double check to make sure, because sometimes those happen. So. I'll go down to the next one. If your child's temperature is too high to enter the bus, they'll have to return home. And then how many students on the bus? We're able to get 22. So we're working on those bus routes coming up. We also are working with BOCES students to get them to their classes as well. Will my child be able to submit a bus note for alternate bus routing? Okay, so this is one of those questions that's very, very difficult. Normally we're very accommodating for situations. The difficulty is we have very limited space on our buses. And we're going to find that we probably are going to get 22 kids on a bus, and then we're going to try to figure out how to, make sure we can get as many kids on the bus as possible. But that 22 number will be there almost on every bus. So because of that, we have very limited space, which means we really that drives some of the scheduling, and we're going to need up front if there's some specific needs. But as things change, really those alternate bus routes are going to be very difficult to fill, and I would say we're probably not going to accept many of those. Normally we're accommodating, but at this point I would say that we're going to need to know your schedule up front to make sure that the buses can hold what they have. So let's jump into the schedule. I see a question that looks like it relates to the schedule. It says, I'm no Coral fan, but he says you have to listen to parents. If top question is remote learning, why offer that? Numbers are so much worse than when we took survey and science about kids changed. So we would love to offer remote learning. It's a great question. The difficult part of that is the amount of staff that would take. We have got our staff to the point where basically we've got them filled in every spot possible. To switch to remote learning for groups of people, it's very difficult to meet that, and also understanding what's best for our for education. Things could change if things that work have to go to remote learning. We'd have to go to all remote learning at that point. So. We've looked at our staffing, and it's very difficult to do remote learning, but we do have that other option for homeschooling. Some of these are really tough questions, and they're really tough answers as well. So I appreciate them being asked. So hybrid schedule, we talked about this. How are students selected for cohorts? There's many factors that come into play. I've already talked about transportation as one of those factors. Another has to do with families. Making sure families in different grade levels can come at the same day for childcare purposes. We've also got scheduling numbers. There might be a class that can be offered only one of the 2 days because of the size of that particular elective. So we have to adjust that schedule. So there's a lot of factors that come in. So folks have asked, can I change my cohort once I find out what it is? The difficult part is that is a domino effect for many different decisions that deal with that. So we've assigned our green and orange, and put around that, and we understand there's some childcare. So I've got some already some resources for that. Not a wonderful answer, but it is some help. Moving to a scheduling outlet. Actually, there's one thing that I usually like to do start off with these presentations with just a quick spiel, and I realized that when this last question came through, and it's a good question. It's not against the question, but when we do these decisions, obviously all of us have a personal opinion about the situation. The difficult part is that we have to take those personal opinions and put them in our pocket, because we're given guidelines of the entities that really control what we have to do. Our political side is where we can push on our political figures, but for decisions that we make, locally, we've got to pay attention to those Department of Health guidelines and state ed guidelines to be sure that we meet those specifics. So I just want to put that little piece in there. Real quick, we've also gone over the schedule outline was shared in our plan, so you could have seen that at this particular point. So it's a more specific description, but if I scroll down a little bit, you'll see that we have the general description. This was sent home with our orange and green, so you get an idea what that looks like. Again, our K1 group is an AM, PM, excuse me, and then our second grade group is full day. Kind of went over reasons in our last presentation about those decisions, and then grades 3 through 12 have a green and orange group that come Monday, Tuesday, and then they also come Thursday, Friday, and then there's a remote learning, deep cleaning, and a meal delivery. And we put in delivery, we're trying to define for sure what that meal looks like. You notice pre-K is not in here, like we talked about the last time. Pre-K was not on the we weren't able to run it. I will say we're looking at this very closely. We have a potential solution where we might be able to get pre-K students in very small groups for a short period of time, maybe once a week. So we might be able to do almost, I would call it a bridges program to kindergarten. It's pre-K material, really focused on getting students ready for kindergarten. So that's not off the table, but we've got to there's a lot of moving parts to make that work. I want to say that we are working on something to make that fit. Oh, great question. So we're talking about schedule. A question just came up. When will parents know if their student in kindergarten or first grade is attending in the morning or in the afternoon? So this goes back to those letters that are being sent home. So those letters should indicate what group they would be in. So those should be way home. If not, you can clearly call the office and make sure that is clear. You can ask the question at this point. Those letters have taken much longer than we expected to get home. So any day now, you should find out. Wednesday, remote learning. So this is one where so I'm going to pick the green group because it's easier to think about Monday, Tuesday, Wednesday, Thursday, Friday. So let's say I'm a student in green group. I'm going to come to school Monday. I'm going to follow my schedule. I'm going to come to school on Tuesday. I'm going to follow my schedule. If it's a block schedule, you'll have 2 different schedules for that day. So basically, you'll hit all your classes those first 2 days. And then for Wednesday remote learning, I've got a specific time that my teacher will set up, and we've set up blocks of time throughout the day. Now, for instance, I only have English teacher. I only have one math teacher. I only have one science teacher. So from 8:20 to 9:20, my teacher is going to tell me that they're going to be available to connect virtually to me during that time frame. It's almost like office hours. That's the best way to describe. So we went over some things in class. Let's talk about them. What problems did we have? Let me review what the assignments are. Make sure you understand what you're going to do for the next 2 days. Okay, so if I'm here Monday, Tuesday, then I'm not going to be in school Thursday, Friday. I'm going to be given assignments to be working on those 2 days. Not a synchronous connection necessarily, but I'll have work to do. That's the engagement piece that we're working on. So just to scroll down a little bit, I'll come back to elementary. What will remote learning look like? That's the piece that we're talking about in our hybrid schedule. So basically, students are going to be assigned independent learning tasks to be completed on those 2 remaining days. So again, Monday, Tuesday. Monday, I'll be in class. Tuesday, I'll be at school. Wednesday, I'll be connecting with my teacher in that block of time. And I've got lots of teachers, so I got different times that I would be connecting. Folks have a connection. I see questions coming in, so I apologize for that piece of. We'll work with students on what those look like. They might be packets that they receive to take home to work, and they could connect. So we're working on that piece of it. To let you know about K-5 remote learning, those grade levels have particular times that they'll be able to connect to their teacher. So. Okay, so I'm going to just take a look. I got a couple questions. I think they relate to what we've been talking about. I see most schools in state are letting parents pick, and I don't think they're hiring more teachers. I think that relates to the probably the remote learning piece. So I'll give an example that kind of works in the remote learning piece of why there's not necessarily a pick. You'll find in our region, the larger schools are probably able to do some of the picking, and the smaller schools are having difficulty with that because we have a, I'll pick a English teacher who teaches the particular grade of English. That's the one teacher for that. So they really, if you're a larger school district, I just got to describe for a larger school district, you might have multiple teachers that teach the same subject. So it's very possible that one of those teachers is the remote learning teacher. In a smaller school, that's the issue that makes it difficult. In some cases, if they were able to get more students in school, they may be plopping a camera in the classroom, which essentially is not what remote learning would be. So it's really just sending the information, sending it home. And we looked at that solution. It doesn't seem practical for learning in that case. Question about, have you surveyed how many pre-K families still intend to send their child if they were eligible for enrollment? What we're looking at is the model, and then we'll be contacting the pre-K families that were, if we're able to run the model, we'll connect with those pre-K families to see if they're able to do that. So that was a good question. Are you offering anything for parents that don't feel safe sending their children? Okay, that's what we talked about in the beginning. It deals with the question around, we really have 2 options. We have the hybrid situation where students can come, and then the second option relating to the staffing issue is the homeschool option, which you can contact the middle school office for that. Good question about IEPs. There are some high schools that have IEPs. Those students will be scheduled to be here every day. We're working on how to schedule the extra help. And so we'll be piecing that together. So we want to make sure that we are following the IEP the best we can to meet what's there. And really, we're able to, with our size, while there's a disadvantage for number of staff, we're also able to address individual students' needs. So we are going to address the IEP, and that's really a conversation with a building and CSE office to make sure that those needs are being met. And we're working on what the details of what that would look like. What happens when a child has tested positive for the virus and was in school? Will the whole school go remote for 14 days? So what happens when a child is tested positive for the virus? Okay, we're going to actually turn right to public health and go to their guidelines. And each case is specific. So that's a tough answer to take, but I'll give you an example. We've had, situations where maybe an individual in our school, professional over the summer, may have tested positive, and we've had to deal specifically with that situation. Obviously, if numbers go up, we're going to have to look at numbers of students in school and what that looks like. But the school will not shut down unless public health says your numbers at this point. They've done the contact tracing. They find out where the contacts are, and the numbers are to the point where we need to we need to close. So we're going to work closely with public health on that. These are tough, great questions, but tough ones. We talked about instruction. We're going to probably put together some videos of what the classrooms look like. Essentially, classrooms are going to be half full. That's the best way to describe it. We are keeping desks in the room. That's actually a cleaning piece. So if there normally are 22 kids in a classroom, and there's 11 students, green for 2 days, and 11 students for orange, we're keeping the desks in the classroom because those materials shouldn't be shared between students. So those students need a place to keep their materials. So that's what that will look like. But everything gets cleaned throughout the day. Okay, remote learning, we talked about graded. This is a good question. Yes, work will be graded, and it will be basically a school year. I know we started off in March that we were holding off on grading, but we're to the point where we've been able to plan. And yes, grades will count throughout the school year, depending on the teacher grading policy. I think we talked about screening. I did want to talk about temperature screening on the bus. But I want to show you what our plan is for students who are getting dropped off. So obviously we've sent out the survey to ask for transportation and what folks are planning on doing. It's still looking good. We're about 50% of our families are saying that they can do transportation at this point. So we're going to continue down the process. So if you're bringing your student to school, the drop-off location is going to change. And that's really because of our temperature screening process. So you'll see that our elementary gym is here. And if you know our campus very well, you've got there's the baseball field and here's the parking lot. So folks will be entering the parking lot, dropping off their students. And in between the baseball field and parking lot, there's a walkway with outdoor entry doors to walk into the elementary gym. In the elementary gym, we have queue lines for temperature checking. Right now, we're starting with about 10 lines. Temperatures will be checked. If a student passes the temperature check, they'll get a wristband and they'll be able to enter the school building. If they don't, we'll actually use our girls' locker room downstairs as the isolation room where we'll do a second temperature check, work through the morning process, and then we'll make phone calls from there for folks to come pick up their children. So that's what that will look like. I see another question came up. One actually looks like a follow-up, so I'm going to jump to that one. So more specific, as a mom of an elementary student, if someone was in their classroom that tested positive, shouldn't they all be quarantined? Great question. And again, we're going back to the guidance of public health, and I want to kind of outline the process because there's a situation where we may have to close the classroom down and move it. Let's go back to a student who's symptomatic. Okay, the student is symptomatic. They come in, they go through. The nurse deems that they are COVID-19. They have the symptoms. They need to be tested. They go to the isolation room. Okay, we're going to come in that space where that student was at that point. Okay, not necessarily remove the whole room. We might need to, depending on what the situation is, but we're going to clean that space. The student leaves. Now they go get tested. At this point, tests take between, at the earliest, it sounds like 3 days to potentially 14 days. So that's why our discussion with public health, we have to work through that. If it's an immediate turnaround and it comes back and they do contact tracing from there, we're going to work from there. So these are tough questions we asked public health as well yesterday, and that's our plan. Will we close the school down? Most likely we won't close the school down. But if it's deemed that we need to close the classroom, we have a couple alternative locations that could potentially work for classroom in the meantime while completely cleaned. But don't forget, we're doing a complete cleaning on Wednesdays, and we're cleaning every night. And so during that time, that room will be cleaned. The question is what's the contact tracing what's taking place? One of public health's statements is that if a student is near another student for longer than 10 minutes without a mask, less than 6 feet, that's a contact trace. They need to be tested at that point. So we're setting up our school districts so that doesn't take place. So that's actually limiting the amount of exposure possible. So it's very important to do this. I see another question. Will students be able to take elective classes in school, such as band course and choral leaders and ag? We have scheduled those classes. They are in place. Will look different. There's no question. But we do not want to cut out electives and opportunities for students. It may look, there's certain guidelines, particularly around, let's say, chorus, for instance. There's certain guidelines where students need to be much farther apart than the 6 feet. So what do we do to make that work? And we've worked with the music department a little bit on that to help determine what that would be. Ag classes, hands-on classes, those are difficult to do, but we have kept those in the schedule. Can kids get a remote learning for at-risk family member? I can't homeschool and don't want to kill the grandparents. Great statement. I don't either. So that would be a question. So there's a doctor's order that we're looking for. So if that's the case, so if the doctor feels that that's the case in the particular case of the grandparents or the situation, that's what we would be looking for, is that conversation with the doctor. So have teachers received better training for virtual learning? At this point, professional development, we've offered some through BOCES and those pieces, so there has been some training. We'll be working through that, for the rest of this summer, through our superintendent's days, those kind of things, so we can work through virtual learning as well. And we know it's a challenge for all that do that. But with students being in school, we're able to get contact with students, and that makes a ton of difference to the remote learning. Visitors to school, we're going to limit the number of visitors to school. They're going to use the main entrance. They'll get screened. They'll need appointments to be here. If you need to get your student, you're going to want to call ahead and do that and go through the screening process. COVID testing going to be done in school. There's the answer around that. I think the big concern about in-school testing, we're not a testing site. We this FAQ that you can get to that gives you information about where to get tested if you're asymptomatic. So want to make sure that one was clear. We talked about Chromebooks in the last situation, so you can take a look. We got Chromebooks available for folks. We're working on, really identifying areas where families do not have good internet connection or no internet connection for that process. Just a side note, Chromebooks are available to have an offline mode where students, when they're in school, they can download the things that they're working on, and they can work on them at home. And then when they sync back up, they'll connect and sync appropriately. Question about athletics. Really, things are on hold with athletics until September 21st. This question has come up, so we put in the language directly from New York State Public High School Athletic Association. We did put some information here about special ed, so there was a question about special ed, and you'll see that our hope is our point is to address each individual is what they need around those. And then if they need special ed services, we've got a process in place for that, as well as a 504 plan. So you can reference that, as well as call the CSE chair, Mr. Bolivar. We talked a little bit about sanitation already. We'll be cleaning between, at the high school, it's difficult to cohort. So in other words, keep students in the same room all day. So they will be switching. They'll be wearing their masks as they switch. But we'll be cleaning those areas and in between classes. And we'll dump into lunch. So I see there's still some more questions. Will you share childcare resources for those parents? Yes, I want to do that before I'm off today to give you a way that it's not coming, not exactly what I hoped for. I can explain why, but at least I've got some sources for you. Will there be a virtual Meet the Teacher night to answer questions about schedule and classroom protocol and safety measures to ensure children are safely transported from gym to the classroom? That's a great suggestion. We've had some discussion around that. Nothing's been particularly scheduled at this point for the entire school, but it's a great suggestion. Will students be mandated to get tested if they are contact traced? I know adults are not at this time unless they choose to. So actually at this point, that's the same situation for students. So, the parent has to get permission to test. What happens though is their contact traces, they fall into that potential exposure, and then public health or the doctor may decide that there needs to be an isolation that go through. So that is, it's a great question, and if they're not tested, that may mean that they have to wait a certain number of days before they have to come back to school. So that ends up being a discussion with public health around that as well. One more question I see is, are you specifying mask types? They need to meet basically cloth masks are the best. If it's a bandana that's around their neck and they can pull over their face, we see that a lot. That's very doable. We're flexible as long as they meet the requirements that it covers the mouth and nose when it's being worn, and their cloth. If they're disposable, they should replace those. If they're cloth, they should be washing those. We do have plenty of masks if folks need those. If students forget, we'll have extra ones to make sure they work. So. Okay, and I have another question. So the family member thing, a doctor is to say they're older than 65, that doesn't make sense. I understand, but that's going to be the question because of the particular situation. We're going to need that information. If the 14 days is all virtual learning, because we'll have the capability. So let me just back up. Before COVID-19, if a student was out for 14 days, we provide home instruction. Okay, now, because in this situation we have remote learning available, those students would be able to participate in their class remotely. And we would work on the days that they were supposed to be in class, what that could look like. So it'd be an individual case for those. Other work for them to work on. Does it count as absence? It would be an excused absence around that. And we identify what those absences are. I'm not even sure right now what the state is requiring us for reporting. So we record an excused absence, and then we actually will have something that says a COVID-19, I believe, absence check that we'll have to tell the state that's why they were out for whatever reason. So great questions. Social emotional support, who can I contact, or my children need help coping with stress? We have our in-house social worker. We have a guidance office. We also have other folks within the building that work that way, and you'll see that information there. Our teachers are very good at really working with our students on how to help them through their process. Okay, so on to childcare. Put this down at the bottom. So will we offer childcare? So we did take a look. Could we offer childcare, for our community? Could we offer childcare for our faculty? Lots of those things. Basically, there's a lot of regulation around a school providing childcare to families. There's some space regulations. There's some staffing regulations. There's actually some other limitations that make it very difficult to do it through the school. So our goal now is how do we connect childcare offerings to folks that need childcare? So that goes right to a question. And we put a link here to parent-student resources. So rather than go to the link, I'm going to show you how to get there from our website, because the link will take you directly there. You'll see that actually that FAQ is still on the website. You can click on that. But if you hit parent-student reopening resources, you'll see that we have parent resources. We can click on that. On here are resources that we've had for quite a while, but some very specific ones. And you'll see this is probably this is one that gives you lots of information around community resources. But for childcare, we had a county meeting around this, working with county services to try to figure out what can we do to support childcare. And there's a lot of regulation around childcare. So what I'm going to do is I'm going to pop out this, and you'll see that this takes you to some resources. I zoom in a little bit. This group right here, this is the third item. This is the group that actually presented to us, and they are probably the main resource to use, the contact to find out about childcare. They have information about who is approved, what's available, all those kind of things. You can also go to their website, register, and put your information in, and put your children's ages and what's needed for childcare, and that'll help match you up as well. In addition, our conversation was also with the Child Care Resource Network, as well as Hand in Hand spoke to us from the county about some resources that they could provide. And this is one phone call that I'm going to be working on in the next couple days. They believe that if they have the need, it is very possible that they have the staff that are able to provide childcare if we can find the space. So looking for spaces that could potentially work. Got some phone calls out to some local entities, some local churches, those kind of things. I'll be calling them to see if we can find some space so we can work with them to actually maybe get some in-district childcare. That's what we're really hoping for. So we're working on that, and you can see Hand in Hand is here as well. They are getting full fairly quickly, so that's one. So always around childcare is the cost question. So back on our resources page, and we'll be posting this, you'll see that on this link is subsidized childcare. You can contact the folks here to see if you can qualify for subsidized support for childcare. That subsidized childcare also works for babysitting. So if there are folks that have students that are babysitting on days and they need to help pay for that, and you qualify for the subsidized childcare, that's a possibility. So I'm going to go back. If I can get back to where I was. Go back to our parent resources page. This other one is really a quick flyer that makes it's very easy to look at. It has the phone number to call to ask about childcare. Okay, so there's some information. Okay, so I'm going to jump over to the questions. I want to come back to nutrition as well. Question was, if there won't be alternate drop-off pickoff for those going half day, how flexible are you in accommodating AM, PM to assist with family needs schedule? In terms of flexibility, changing every day, that's going to be a very difficult one. If we know where they need to go and we can make them work on the bus, that's what we'll need to do. But moving, what that does is that affects the number of students on each bus and how that could work. Maybe our AM, PM runs are going to have smaller numbers, so there might be more flexibility. But really, we're looking for be very specific around what's needed for those deliveries, for those student transportation. Is there any flexibility in changing the orange or green days if more than one parent would like to change days if childcare is not available or they cannot get into any of these options? We really, because of the, normally I believe as accommodating as we can be, but because of the multiple factors that affect the orange and green, we are really going to need to keep those groups the same to work through that. So that would be a Monday, Tuesday, Thursday, Friday transfer. So at this point, we're not making changes. These are tough decisions, but it's in order to make this work, we've got to make some hard choices. So let's talk quickly about lunches, how those will work. So in school, lunches will be delivered. I'm sorry, excuse me, I got to jump back. Lunch, so breakfast. So when students come and they check into school, they're going to go right to their classroom. So right off the bus, they go to the classroom. If they go through the screening process, they're dropped off by their parents, go through the screening process, go through the gym, they're going to go right to their classroom. At that point, we're working schedule for faculty to be able to determine what time they could send students to breakfast to go pick up their breakfast and go back. So they'll have a specific time which limits the number of students in the hallway, and the cohort really stays together at that particular point. We looked at delivering lunches, and it didn't seem that made much difference because we're able to separate students in a schedule, as well as we're able to bring them through the line, give them a little bit of a break from being in their classroom, and then head back. And that is actually K through 12. So that's actually the same process for lunch. So breakfast, students can leave, they go get their breakfast, and they come back. Now they'll be pretty much, most likely the entire class will go, because you'll keep the cohort together. And it'll be the same thing for lunch. The class will get up, they'll go to the lunch, they'll go through the line. Even if they brought their lunch, they can just come right through the line. And then they'll head back to their classroom. A question came about lunches in terms of, are all students able to receive lunches like they were at the end of the year? So last year, that was an emergency situation that the federal government allowed waivers for. So really, that ended June 30th. So now going back to school, we're looking at basically the payment of lunches is pretty much the same. There are free and reduced lunches, so if you qualify for that, and we've got on here under our food services, under parent resources, the paperwork for that, so you can click on that, and also we're sending it out as well. There is also paid lunches for students, and so they could pay for their lunch and get that. We're working on a process of what that would look like for food delivery for students who aren't here. For instance, again, I come to school Monday, Tuesday. Wednesday, we're looking at having the meals provided for Wednesday, Thursday, Friday, or if I'm a Thursday, Friday student, I'd have meals for Monday, Tuesday, Wednesday. So students who get free and reduced lunch can sign up for that, and they can get that those meals. And students who are not would be able to pay for that. So we're working on the process for what that will look like for lunches. But we're back to the way things were a year ago, except the way food is getting delivered is an entirely different process. So we are back to that point, unless a waiver comes by again. So we're waiting to see if that happens. So, clarification on a question. So I guess if we get an option that doesn't work for our family and daycare, is it possible to switch them to the other half day? It's very similar to the green and orange prop. Right now, we're holding tight to what those are. And we'll need to keep them pretty much where they're at this point. Are you doing any more surveys? Good chance we do. We'll be working together on what that may be and asking for input for folks. But obviously, we've had to make some decisions and move forward. So we've got some input. We may be looking for more information. It might be a letter, it may be phone calls, depending on how we're looking for that. If families cannot accommodate the hybrid model, what options do they have? It depends on what you mean by accommodate. I think you'd want to talk to us about what that means. Really, the two options we have at this point are the difficult ones, are the options for the hybrid schedule, or if there's a medical reason to be remote only. And then the last one would be homeschool instruction. So if a student has tested positive in my son's classroom, can I refuse to send him and have him remote learn and have it be an excused absence? Again, so going by public health guidelines, if we're allowed to keep that classroom open, that would be a classroom that is open for that day. If a parent at any time can choose to keep their child at home, that's never changed. That's always been that way. It's not an immediate move to remote learning. It's more of a, what did you miss when you weren't in school, and how do we make up for that? So as far as an excused absence, we have talked about that internally. That's probably more definition of an excused absence. So I'm going to have to do some research on that piece from there. So, and I want to put a caveat out there. This is what we know right now. At this time, between now and tomorrow, something can change. Between now and Friday, something can change. And we're going to give out information as it comes for that. So, there's another question, but thank you for all you guys do at the school. I know maybe these plans couldn't have been easy for everyone. Thank you. It's not easy, but I know it's not easy for home too. It's very difficult. This puts a burden on homes for sure. Trying to connect families for childcare is a piece that we're trying to help with as well. If enough people do medical notes for grandparents, would it be easier to just make a program and let anyone do it? Well, if we have that many kids at home, we might have to do remote learning. So that's that's kind of off the cuff comment, but it's true. If we've got students not in school, they're going to need to learn, and we'll have to do remote learning. Would that free up staff? It could potentially do it, and we'd have to work our way around that. The difficult thing is we don't have a ton of staff teaching the same subject. If we had more, I think we'd be able to get that other offer out there for you. So, so that's where we're at with that. I think I've hit most of the topics that I wanted to. I want to make sure I hit childcare. I want to mention the information about pre-K. We've hit the FAQ document. We'll continue to post that up there. As far as communication, we're going to continue this process. We'll be making, the phone calls. I'll do School Messenger. We are updating that system to a system called Parent Square, so that may look a little bit different. But we're finding that system is, and it's one that many schools use. We're finding that it actually communicates quite well, a little more efficiently, and it's very consistent between classroom communication and even building, as well as district communication. So we'll be upgrading that soon. Thanks for countless hours you and your staff have put really for school and community. We appreciate all you doing, Kip. It's from a former graduate. Thanks, Hannah. And we're working through it. We know there are plenty of problems with what this is. We're trying to solve as many problems as we can, and sometimes those problems create other problems that we want to mitigate. So, anytime you've tried to organize a multi-level, multifaceted organization, one change in the environment affects many other areas. So I'm trying to hit the mark in many of these areas the best. I've got a wonderful staff. They've been working really hard, working on the schedules. The schedule work. We still have lots of questions, but every day there's a few more answers. I want to let you know that we're going to do another forum next Wednesday. We're going to do that Wednesday night at 7 o'clock. So we'll do a very similar forum. Maybe some, hopefully there won't be more guidelines that come out that cause some changes, but maybe we'll be able to give you some more answers around some of the questions that have come our way. So just going to kind of keep talking for a minute here. The YouTube's about 20 seconds behind me. So if a question pops up, I want to make sure I get to it. I've got about 5 more minutes to make sure that we've got the full hour. I want to say that the community has been tremendous. A real quick mention about Facebook. If you're on Facebook and you see a comment that doesn't have, there's not accurate information. I want to thank you all for joining this. A lot of folks couldn't join, I understand, but you're engaged in what the process is. You want to know so now you've got some of those answers, and if you see some misinformation, it would be wonderful to put it out there to say, take a look at this, the district and FAQ. We'll be posting that, we'll put the video up tomorrow. We'll be posting actually some more childcare resources on the Facebook page, and then we'll also post the FAQ, just a notification for that, and we'll continue to release information. And I'm thinking we do not have any more questions. I got folks thanking, and I want to thank you all. Honestly, we have a wonderful community here. Well, it feels like there's not a whole lot of time, and there's a whole lot of work being done. I know we have a community that wants to make this work for our students, for our kids, and really that's why I work here. So thank you very much, and I wish you all a wonderful evening. Good night.